it. This can't happen to nurses. Nurses know better, right? Maybe you're sitting there going, why am I here? I know not to do drugs. I know, just say no, right? We grow up, dare class, just say no, drugs are bad. Why am I here? Let them suffer. They made the choice, right? It's not really a disease. Is it a disease? How can it be a disease? Well, the ADA does recognize addiction as a disease, but to most people, that's not good enough, and it wasn't for me. When I first started, that wasn't good enough for me. It was an excuse. How is this possibly a disease? If I made the choice to put this drug in my body, how is it a disease? Well, I tried to read some comparisons, some studies, some different angles on it, and I don't know how many of you guys know somebody out there that has or maybe suffering with COPD, right? What's COPD? Lung disease, right? How do we get lung disease? Through the choice of smoking cigarettes, right? Nobody lights up that first cigarette saying, you know what, 40, 50 years from now, I'm going to have COPD, I'm not going to be able to play with my grandchildren, I'm going to be attached to an oxygen tank, and maybe I'll even have lung cancer. No, they don't do that. They don't do that. Every puff they take, every drag of cigarette they take alters their lungs, opens up the alveoli, tightens the bronchioles, and they develop lung disease. It doesn't go away. The same thing happens with the addict that takes every drug, every sip of alcohol. They're altering their mind. Things in their brain are changing, so they don't think like you or like you or like you. They think differently. But I don't understand that. How is that possible? They know not to do it. That's not good enough for me. Well, most of us here in New Jersey drive on the New Jersey Parkway, right? Maybe even to get here today, we all drove on the Parkway, most of us. So a few years ago, I'm driving on the Parkway, and I'm passing the brick exit and exit 90, and they cleared out a bunch of trees on the side, and I'm like, oh, what's going on over there? They're doing something different. A couple weeks later, they start paving, doing different things, and now they have a new exit in, exit 89, A, B, and C, right? You take your GPS, it's not even on there. It comes up at Cedar Bridge Road, and you don't know which lane to go, and it's switching so fast, and everything's different. I don't even remember how it used to look. That's what's going on in the brain. There's construction going on in the brain of an addict that keeps on using, that keeps on abusing, that keeps on taking that medication, that the ramps and the exits are getting altered in the brain so it's not like yours. Their parkway is different than yours. The problem is they don't realize it. So you got to help them realize it. But I know I don't like that analogy. That's a stupid analogy. I know when there's road work in my head. I know when things are going wrong. I'm not addicted to drugs. I don't smoke cigarettes. I need another example. Well, I love cookies. I don't know about you guys, but I love cookies, right? Dominic, do you love cookies? So I know when I have cookies, I'm not just going to have 1, 2, or 10. I'm probably going to have the whole tray. I'm probably going to have a lot. I have that compulsion there to have more than one cookie. And working in healthcare, there's usually dessert and cookies everywhere, right? Working in healthcare. So I know that. I know that if I bring chocolate to a conference or to a presentation, most likely people are going to stay awake. Right, Vinny? See, he was about to close his eyes, but now he's awake because he caught that. I know that. Lack of control, continued use of substances despite devastating consequences. Now, luckily for me, I'm not going to get behind the wheel of a car and crash it because I had too many cookies or too many chocolates. I know that. But maybe you guys are sitting there going, you know what? I don't like sweets. I don't smoke cigarettes. I don't do drugs. This is ridiculous to me. How much longer do I got? I want to get out of here. Well, at any given time, I can hop down into the crowd of wherever I'm speaking, go to any table, and pick up a cup, right? Coffee, right? This is actually full. Good job. Usually they're empty. Coffee. What happens when you see a picture of coffee? Get all warm and fuzzy inside, right? Sometimes even when you smell it, you're walking into Wawa or wherever, you smell it, you start waking up. Everybody loves coffee. Well, what's in coffee? Caffeine. Is that a drug? Yes, but people love it, right? People love it. You may love it too, even though you don't like desserts or smoke cigarettes or do drugs. You might like it too. Now, what happens when you wake up in the morning and you don't have your coffee? I don't know, man. I don't know. I don't know if I want to work with somebody that looks like this old lady with a bat. Would you? So how much more do you think the person that's looking for that extra drug, that's looking for the extra Percocet, that's looking for the extra Dilaudid is going to feel? If coffee makes you feel like this, how do you think that drug makes them feel? And you're going to work with them. So the one thing you got to take away from this, guys, and I'm going to stress this a couple times throughout this presentation, is as nurses working in healthcare, we got something that most other jobs don't have, and that's gut. That's instincts. We know. We know before a patient crashes, they're going to crash. We know something's wrong when they come into the room. We know somebody's lying before they admit they're lying. We know. If you have this instinct, you got to follow it, because most of the time you're going to be right. You're going to be right, and this person may be too late before they say anything. So remember when Red Bull first came out? Way back in the day, Red Bull gives you wings, right? Little 8-ounce cans, very popular. Well, now they're almost triple the size. And why is that? Because society's addicted to caffeine. Caffeine's an accepted drug. It's pushed, it's promoted. That's how I got most of you guys here today. Come here and I'll have coffee and dessert, right? You guys walk in there, where's the coffee?